pleased, though, to introduce Jamie Roeke, who has worked in Mayo Clinic Public Affairs for the past 3 years. Before coming to this position, she worked with as the marketing manager for the Kaler Hotel Properties. She grew up in South Minneapolis. She's also lived in South Dakota. She's been living in Rochester for the past 7 years, where she's been very involved with local organizations, including the Rochester Chamber of Commerce. She received a bachelor's degree in business and management and a master of business administration from Augsburg College. She is married, and she and her husband Chris have 2 children. So please join me in welcoming Jamie. And I want to apologize ahead of time for the computer. We're having some issues with it sort of linking on and off, so I'm sorry about that, but I think it's still pretty viewable, so thank you. Thank you, Margaret. Hi, everybody. How are you guys doing? Lunch was okay. I was just talking at the table. I said, I don't know when it's best to go. Is it after lunch when everybody's tired? Is it the end of the day when everybody wants to go home? So if I see you start to get drowsy, I might have you stand up and do some interpretive dance or something like that. Is that okay? Okay. So, like Margaret said, my name is Jamie Roeke. I help to oversee the Destination Medical Center initiative. I work for Mayo Clinic, and there's a few of us that have our staff time allocated to overseeing the initiative while the governance structure is getting in place and kind of the checks and balances are there. And as the EDA staff gets hired, we'll start to hand over some of that work to them. What I thought I'd do today is root us a little bit in where DMC is, where it came from, and then talk a little bit about some of the concepts that are coming out as we've been planning. And then I asked Nelson Nygaard, who are our transportation consultants, to give me some information, a little bit more about our transportation strategy. Now, I am not a transportation strategy specialist, but I'm happy to share with you some of the concepts that they're coming up with, and then hopefully we can have some dialogue, and it can kind of be back and forth, and you can share information along the way. Does that sound okay? Good to go? Okay. So let's jump into Destination Medical Center. So before I jump into our fancy slide about mission and vision, how many people know about the initiative? I would guess that Destination Medical Center is something that's there. How many people have been to a previous presentation about Destination Medical Center? A few people. Sounds good. People from the Rochester, southeastern Minnesota area? Hello? Okay, sounds good. I might point at you. Feel free to chime in anytime. So. DMC is really an economic development initiative that secures Mayo Clinic, Rochester, and the state of Minnesota as a global destination for healthcare. We know that we have a great organization, Mayo Clinic, within Rochester, and we wanted to find out a way, how do we leverage the great things that are happening there? We know that we're going to continue to see a lot of growth at the clinic, and we need to be able to support that growth. The other big piece about Destination Medical Center that I think is interesting and is challenging for me all at the same time is the name. When we say Destination Medical Center, it tends to be focused on our visitors and our patients. But in order to create a great sustainable area and region within our community, we need to make sure that we're focusing on the members, the community members, and the area community members that use that space. So it's not only about our patients and our visitors, but it's about our community members as well, and creating the best experience that we can for that region. So again, a little bit about DMC and the types of conversations we started having is that we knew that we had a lot of growing pressures on the state of Minnesota. We know that there's competitors of ours, of Mayo Clinics, that are looking at our model of care. We have a very unique, okay, interpretive dance time. Okay, we're back. We have a lot of competitors that are looking to look at the way that we provide health care at Mayo Clinic. I don't know if you've had a chance to experience it before, but it's something truly unique and different when you come in to receive health care at the clinic. And so there's other competitors, like I said, that are looking at that. We also know that affordable health care is something that is changing right now, and that's changing the way that we offer our health care as well, along with other pressures. And so we started having conversations with the state and within our region saying, how do we prepare for these changes, and then how do we leverage what's happening at the clinic already? The other thing that we started to do is we started to do some really interesting research to figure out what do we know about our region and the people that are there. Now this is like a ton of interpretive dance time. There you go. a ton of research that happened all on one slide. So I want to quickly go through it, but it gives you a sense of what our needs were within our region. So the first graph that you see is called the experience gap. When we do surveys within our patients, we know from that experience, we had people that rounded with them every single day while they were here or in Rochester experiencing the clinic. Their experience was wonderful. Everywhere that they went, every touch point within the clinic, from the time that they met the person at the front desk to the time they met their oncologist to their lab specialist, their experience just kept getting better and better along the way, and they felt more hopeful and more excited about their experience. What we also found is when they went into our community, we have a really great community, but they were looking for things and not able to find things. And it's not that those experiences were bad, but they had a hard time navigating or a hard time finding what they were looking for. So for an example, you might have someone coming to Rochester on our executive health program, and that person might be looking for a space to touch down, to have a phone conference or to do a quick meeting while they're there in town, and they had a hard time navigating and finding those things that they were looking for. Or a family might come into the community and their experience within the pediatric area was wonderful, but then they were looking for a place to have downtime with their children and didn't know how to navigate our community. And so that's what we call the experience gap, is that people were talking really great about Mayo Clinic, but then in the community they were having a hard time navigating. Now the piece that's most important to this is about the amount of time that our patients spend within the walls of the clinic. What we found is that 70% of the time that they were in Rochester were not within the walls of the clinic. 70% of their time was spent in our community, and 30% of the time was when they were actually in our clinic. So now you start to see, if they start to rate things, which experience they're going to start to rate more. They see it as a one full experience, and you're going to start to shift. So they're not confident in their choices. That'll start to reflect on the clinic as well. The other piece of the quality gap that I touched base on is that we were asking about their perception of quality. And this was really interesting as well, is that 45% of our patients felt that they were very satisfied with the activities and the experiences that we're having, but only 29% of our community members were satisfied with the experience that they're having in our community. And that was another big gap. If you come and visit our downtown area within Rochester right now, what you'll find is our downtown is really geared towards what Mayo Clinic does every single day, which is meeting the needs of our patients. But those needs happen between the hours of 8 and 5. And so our restaurants and our shopping, those stores close down, our skyways and subways close down as well. Our transportation closes down too, because we bring in all of these people to work at the clinic and we bus them all away. So there's no reason why those stores would stay open. And so you're going to see those numbers go down. So we know that we have some transportation needs within the next 20 years. Right now, we bus in, my Rochester people, I'm looking. We have 34,000 people that come into downtown to work for Mayo Clinic, and we bus in the majority of them in from all of our surrounding communities. We have some flat lots. It takes about, right now Mayo does provide some parking for those people, depending on your years of service. And right now it's about 15 years you have to work at the clinic before you get parking. Otherwise you have to use some type of other transportation system in. We have a priority parking for our patients, but even at that point, so there's still some challenges with that as well, especially with where our campus is located. So what our planning consultants, Nelson Nygaard and others have had this conversation around is we need one space that people can come in and into close proximity of our downtown, connect with the different ways that we currently are using transportation and then some places in the future. And then we would use different transportation systems to help move them down, so north and south and east and west. And we'll take a look at that in just a minute. One more slide. Yay. Okay. So we have a really great park that's the first original park in Rochester called Central Park. And this is where they start to see where, just north of that would be where our main transportation hub would be. So just on the top of the slide, you'll start to see kind of some circular buildings and then some parking ramps behind it. You also see the line for the future zip rail. In a previous presentation, I said zip line, and I was confusing people. And I thought, well, that'd be fun to zip line in, don't you think? Everybody wants to ride. I thought it was creative, but no, that's the whole point. But, so we'll get to the next slide here, because I think one of the things we've been talking about is The importance of multi-use spaces as well. And so you'll see here kind of in the middle where it says Transit Terrace, that's where we see kind of a multimodal transportation hub coming in. The circular building in the middle is a parking ramp, and then we have flat ramps kind of behind the scenes. We also know that multi-use buildings are really important, and we just don't want people to come in and use the ramp to park. They see some type of grand hall or another space, so it's multi-use. And then activating the park in front of the space as well. And this is where those loops would connect in, and I'll dive into that a little bit more. So what I'll do over the next couple of slides is just dive into a little bit about the transportation strategy in general. We'll focus on kind of 4 key areas: access and parking, transit, streets, and then walking and biking. And these are, again, some of the concepts that Nelson Nygaard and Perkins Eastman have been coming forward with and talking with us about. We know that we need to ensure convenience, and proximity is really important for our patients. It's very interesting if you come down to Rochester and watch the way that people move throughout our city. One thing that I think is interesting too is that you have to look at the needs of our patients. Our patients, many of the times, are not mobile. They are in wheelchairs, they have limited mobility, and they're in a fair amount of pain at times too. And so when you look at how do other countries or cities and spaces move people around, the challenges that we have is that it can't be jerky, right? You can't put someone who is dealing with a extreme amount of pain, jerking them through certain streetcars. What are our options? They also need to be able to get to doors and entrances easily. We've heard lots of really interesting stories about how patients want to move from point A to point B, but it's a very busy road, and so they actually will get in a cab. The cab will pick them up at that hotel and then drive them across the street and down the block to the front of the hospital, because that's the only way that they know how to get there safely. And because of their mobility needs, that's the easiest way for them to move. So it's something that we're paying really close attention to. Creating a once park or park once environment is important for not only our patients and visitors, but myself as well. You know, I work downtown, and I live just outside downtown, about 10 miles or 10 minutes away or so. And that's something that I need too. I need to have access to my car at some point, so if I need to get my children. But I don't need my car by me all day long, because it just sits there all day long. But if I can have access to it, park once and go, that's what I'm looking for. And that's what a lot of our male clinic employees are looking for as well as people that live downtown. We also need to make sure there's been a lot of conversation around access and parking, around priority. Who should have priority? Right now we're basing it on years of service, but is that really the way that we should be doing it? Who needs it, and when do they need it by? This is a great map that Nelson Nygaard put together. It just talks a little bit about how people move into our downtown. The circles on the outside are some of the ways that we bring commuter busing in. We have many buses that bring people in every single day, back and forth, including Minneapolis and St. Paul. I think there's 3 or 4 buses currently that go back and forth around the smaller communities as well. So we know that we need to bring them in. Can they park and ride in from that point, or do they drop them off? Right now, most of our buses drop off at the front door of the clinic, and is that the best way to do that? And then we also need to know we need to move people around our downtown. So the current standards are, if we continue to grow, we're going to need 30,000 new parking spaces, and that I thought was very interesting, is equivalent of a 9-story parking structure on every existing parking lot in our downtown right now. That's not going to work, right? We're already getting complaints about all of our parking structures that are taking up our space in our flat lot. So we need to change the way that we're looking at this, change the way that we move people around. And I'm sure one of the things I think is really interesting as well is, you know, we're kind of in this space of Rochester is 100,000 people. It's a great sized community, but we're starting to grow, you know, into a larger city. We're starting to move into that space. So getting people to think differently about how they move and how they want to move is going to be very challenging. That's something that we're trying to learn about. How do you change people's behaviors, and how do they adapt to that change as well? Let's talk a little bit about transit. We know that we're going to need to continue to bring people downtown. We want to make sure that we can connect people with all of those different districts as well. So we know that the core of our people work in those core buildings in the center, but we have other districts as well. One of the districts I didn't talk about and didn't touch base on is the UMR, so University of Minnesota Rochester, expanding in our area as well, and so we need to move students in. A great story about them right now is our transit, our public transit, is set up for our employees. So it really starts in the morning, ends in the afternoon, and our UMR students can't use it. So they can come in and take their morning classes and use public transportation, but they know that it starts to shut down at the midday to end of day, and so they have to go back to their house, get a car, and drive back downtown so they can take their evening courses. And that's a big challenge for us right now. And as they grow, they're going to have more needs as well. Yes. Let's go to the next slide. So this is a really great slide. Sorry, I don't know if you can see what they're talking about, but I thought this was a good one to give you an example of how they really want to move people east and west. We have a couple lots that kind of sit on our peripheral right now that work well, but we can utilize them better. But then they want to create this loop that really, that's the green circle that moves people throughout our downtown. And it just gives you an idea of what are some of the ideas and how they want to move people around our area. And it's a close-up view of where they feel parking can be for our priority patients and the main parking hub on the north. This slide talks a little bit about some of the options that we're looking at. When we went on the best practice trips, I thought it was really interesting to try out these different spaces to see how do they work. We spent a lot of time in Portland, was one of the spaces that we're in, and I was really amazed at just how well it was integrated into the system. There was times that I didn't even know that I was on a road that had a streetcar that was going to be there, just because it was so integrated into it. So you find these really fascinating streets that weren't super large, but allowed for a streetcar, allowed for pedestrians and bikes, and then it had a parking lane and a driving lane. And you did feel cramped or crowded, but it was just a nice, comfortable way to move throughout the city, and we found that throughout many places. It was also interesting to try some of these enhanced buses and automated rapid transit systems. One of the cities that we went to talked at Bellevue, Washington, we spent some time in, and they're in the process of putting in a zip rail, not a zip line, zip rail, that's how they got back and forth. And it was really amazing to see how they connected it. You know, there's a lot of conversation right now with this zip rail about, do we connect to Chicago, is it to Minneapolis, how do we connect with the areas that are around us? But what's also important, I think, is how it arrives into our space. And in Bellevue, they're creating something called the neighborhood, where the zip line comes right into a neighborhood. And they really see this younger generation coming in, not wanting cars, but wanting access to that zip rail. And so there's lots of really great conversations right now about how do we use these different spaces on different modes of transportation. How am I doing on time? Am I doing okay? So we have doing okay? Okay. So streets are a big conversation right now. We've had a couple of street projects happen on 2nd Street. They've changed the way that has worked. There's also some, I'm not sure the term of it, so you have the main street. I'm going to tell you where I'm at now. Here we go. So 2nd Street's here, but then we have our next streets off of it, and they're starting to work on those streets as well. And that's really right now where we see a lot of our pedestrian walking and our bike travel happening. And they've created those streets to help alleviate some of the traffic on that main 2nd Street. And they're starting to work really well. It's fun to see them come together, but they know that they need to do more. We also know, again, that there's some really interesting spaces from St. Mary's to downtown. It's about a mile. But what's happening is that no one wants to walk that mile. It's very easy to walk, except in the winter. But there's nothing for people to do and see, and at times they feel like they can't cross streets. So how do we create spaces in order for people to do that? One more. And go to the next one. We're getting there. So there's like some of the concepts that they've started to come up with around how do we build spaces that our pedestrians can walk, that we can have some type of mass transit that move us east and west, for example, between St. Mary's, but that we can also have cars too, because at this point, I think the conversation is that we can't completely shut down cars to 2nd Street. And there's many, many more renderings and examples on our website of some of the concepts that they're starting to come up with for 2nd Street. These are some of the examples of some of the different types of streets that we've seen on our trips, where they call them shared streets. I think these are becoming a little bit more common around our country, and we're starting to see a lot of conversation about people just wanting to be walkable but have access to transportation as well when they want it. It's another great example of some of the types of streets that we saw on our trips. One of the other things I wanted to mention about transportation too that I thought was interesting, so we went to 6 or 7 different cities on our transportation and best practice trips. And one of the pieces of information that we came back with, but we didn't really come in with the intention, is that we knew we wanted to learn about places that had seen significant economic development. But the key message, one of the key messages that we came away with was the importance of investing in transportation early and building in that infrastructure. I thought that was very important. Some of the cities that we went to talked about how they wish they would have invested that early. That was a really clear message to us. We met with developers in these cities as well and talked with them. One of the key messages that many of them we came away with after talking with them is that they will not develop 2 blocks away from the major public transportation routes on these streetcars. That they know that the groups that want to live downtown want access to that, and they don't want to walk farther than 2 blocks away from it. And so they will not even look at anything past 2 blocks from mass transportation. So I thought was interesting as we start to build out our transportation. The other piece with that I think is along with the same conversation is that it spurs economic development. How do we connect people to the things that they want to do, retail, dining, cultural activities, because currently right now it is limited. So this is back to the slide that I originally showed. You kind of see the different districts, and now that we've talked a little bit about transportation, you can see about our need and how we need to move from St. Mary's Place to downtown. We have people move back and forth, hundreds and hundreds of people move back and forth every single day. Then how do we pull people in downtown as we grow without building 9-story parking ramps? And then as we see the other pieces of our city grow, how do we support UMR and then the growth of Mayo Clinic as well? This is a quick slide just about our timeline and the things that we're going to be going through. So the star is off. We're actually in November now. We're just finishing up this preliminary plan. And so what we'll do is tomorrow we have a big day for DMC. We have a large public forum, our 4th in a series of probably 5. We'll see maybe 5 or 6. The community will get a chance to see the plan. They've seen iterations of the plan throughout the last 8 months. We're also building out the financial framework and the business strategy. That should all be finishing up. And in December, the DMCC board will take a look at that plan. They'll do a pre-approval of the plan, and it goes to the city of Rochester. The city of Rochester will go through a 60-day vetting process with the community and the public, and then we'll approve their final plan, and then it'll come back to DMC to be implemented. A couple resources if you're looking for more information about DMC. You can go to our website, which is dmc.mn. You can, if you're active on social media, we have a very active social media site, both on Facebook and Twitter. Another place to go is the blog. We have a lot of conversations happening there. We have a newsletter that goes out a couple times a month. If you have ideas or questions, or you would like some type of presentation or want to connect with us, the info@dmc.mn is the best way to connect with us as well. And with that, we can open it up